Utah County woman who underwent an emergency C-section is fighting for her life after contracting COVID-19. The woman followed guidelines from the two leading women's health organizations. They said to consult your provider, then determine whether to get the vaccine. News specialist Debbie Worthen talked to her family tonight. Debbie, she's in the majority when it comes to pregnant women and the vaccine.
That's right, Deanie. In fact, what I found out tonight is 80% of pregnant women are not vaccinated. Now, less than 2 weeks ago, those two panels that make recommendations to medical leaders across the country changed what they recommend for pregnant women. They now say there is enough data to consider that the COVID-19 vaccine for pregnant women is the best way to keep those pregnant women and their newborn babies COVID-free.
She is a stubborn, strong, vivacious young woman.
These were simpler times. A younger Grayson Bakes singing.
I don't even recognize your face.
Nothing like this last week.
We are not thinking in terms of how long it's going to take her to get well. We're thinking in terms of her survival.
Tonight, Grayson and her newborn son Lennon are both in the hospital. Grayson is in the fight of her life. She came down with COVID last week. She was 34 weeks pregnant.
It's really such a day-to-day thing.
Grayson wasn't vaccinated, and she is not alone. Most pregnant women are not.
Our best estimates are about 20% of pregnant women in Utah are vaccinated.
It's not just Utah. That number is just slightly less than the national average of 22%.
This is a population of people, pregnant women, where it's understandable that people might be slow to adopt it, but there is enough information now that we really should be making that move and really pushing to get people vaccinated.
That recommendation change could have kept Grayson out of the hospital. Instead, she's on machines to help her breathe, maybe even unaware she has a son.
We are not confident that she is aware of what's going on.
The Bakes family has a strong message and hopes their story is enough to convince others.
Just get vaccinated and wear a mask. This is a small thing. It's a mask. This is you caring enough for yourself, for your family, and for others in your community to be cautious.
When I talked to Dr. Esplin about that percentage, that 20%, I said, how do you feel about that? He said he feels a sense of urgency to get out the message to pregnant women and their families that that new recommendation is out and the vaccine is the best way to keep them and their newborn babies safer. The family has set up a Venmo account if you'd like to help out. She obviously is going to have lots of expenses coming up with a new baby and not the ability to be working. We will put that Venmo account on KSLTV.com.